Finally, the day arrived when we are going to enjoy the seminar by Dr. Leisy Muñoz on such very important topic as how to help our children manage their emotions. I would like to give you time for everyone to connect. Today, thanks to social media, we have more than 20 countries connected in the three main languages of the Inter-American Division: English, French, and Spanish. I already see countries like Colombia, Trinidad and Tobago, Guatemala, El Salvador, St. Lucia, Honduras, and many more. If you wish to say hello, leave your country's flag in the comment box so we can greet you. Before we begin, I would like to invite you to share with your friends so they can benefit also from this program. With no further ado, we begin our program. IADPA, the place where every book is a brand new world.
I am happy to be part of this series of events that starts today in partnership, the Ministry of Adolescents and Children and your publishing house, IADPA. This is a great adventure, and today we are going to start having a seminar that is very important, helping children cope with their emotions. As you know, today, more than ever, emotions are running low, and we need to empower our children to learn how to deal with all that. We are going to have a series of more seminars coming up, but today especially, I would like all of us to just listen, open our minds and open our eyes and learn what God has to tell each one of us today. Let's pray. Dear Heavenly Father, we thank you for this opportunity. We thank you because we have a publishing house that is interested not only in the written word, but reaching parents, reaching children, reaching teachers and leaders with the know-how for life, just as Jesus would like us to do. Help us today as we listen to your words, as we open our minds, and as we understand our great responsibilities. In Jesus' name we pray. Amen.
The place where every book is a brand new world.
It is a pleasure for me, on behalf of IADPA, the Inter-American Division Publishing House, to welcome you to this program. It fills me with joy to be able to give start to a series of instructional programs aimed to give our parents some necessary tools for the difficult and irreplaceable task of bringing our children to the feet of Jesus. I want to begin by thanking Dinora Rivera, the director of the Children's Ministry of the Inter-American Division, for her leadership and active participation in the development of this initiative. There is no doubt that without her guidance, without her clear ideas, and her commitment to the best care for the children in Inter-America, it would not have been possible to start this program today. I want to remind you of a biblical text. By the way, they are words and instructions given by God Himself, and that is recorded in Deuteronomy chapter 6, verses 6 and 7. I will use the New International Version, and it says, "These commandments that I give you today are to be on your hearts. Impress them on your children. Talk about them when you sit at home and when you walk along the road, when you lie down, and when you get up. It is clear that we must make all our effort to guide our children on the path of the Lord. That consistency in instruction is God's plan, and that the more trained those who guide them, they will do a better job. Also, the good example of their parents is fundamental. The preparations for this event, the people who will present the instructions, but especially you who see us, will make this program a very special program and will surely be a time very well used, in which we will learn together, guided by a specialist on the subject of how to manage emotions in children. The central part of the program will be in charge of Dr. Leisy Muñoz, Doctor of Medicine, specialist in Child and Adolescent Psychiatry, who has kindly agreed to give us part of her time to give a seminar entitled Helping Children Cope with Their Emotions. It's a current and necessary topic, especially in this troubled world in which we live. Enjoy this program. Thank you for your distinction that you make us by participating in this instructional event. Let us remember that our children are the main treasure that God has placed in our hands, and that carrying out the task requires a total commitment from each and every one of us who interact with them. May God bless this program, and that together we may achieve the proposed objectives.
Thank you so much for joining us here this afternoon. Indeed, I'm so very happy to be in such good company. And thanks to technology and social media, we can get together with people from all around the world as we're doing right now. I want to welcome all my friends who are joining us right now in our 3 languages, our English, French, and Spanish-speaking friends. We're so glad you could tune in and join us today. Now let's jump to the main section of our program, the interview. Today we will discuss a very important topic which has really been trending in recent years, and it's helping children cope with their emotions. I want to welcome Dr. Leisy who is from the Dominican Republic. A very beautiful place, actually one of the most beautiful islands I've ever visited. And she will be leading today's seminar. Dr. Leisy has more than a decade's experience in child psychiatry, and apart from her vast work experience, she has specialized degrees. She's a physician, a family and couples counselor, and she's a specialist in child and adolescent psychiatry. So let's welcome Dr. Leisy to today's exchange. Good afternoon, Dr. Leisy.
Thank you for the invitation. I'm very happy to be here and to share with you and your listeners at this time.
Again, because we know that you have a very busy schedule. We are very grateful that you're dedicating this time to the Adventist Church of the Inter-American Division. As I mentioned before, Dr. Leisy, this topic of helping children with their emotion has been really picking up attention recently. Lots of parents are in search of information and want to know how they can help their children. And since this topic has so many ramifications and is quite complex, let's try to broach it from the best angle possible, keeping in mind the few minutes that we have for our interview. And I think that the most important thing is to start at the beginning, though that may sound redundant. But let's talk about early childhood, Dr. Leisy. At what age can a child really know what emotions he or she is feeling, or can control his or her emotions, and what are the emotions that small child can feel?
Marvelous. I see you're very excited. And the the emotions are no more than, first, I'd like to take some time to explain what they are. They are the expression of the response to the stimulus of the environment. That is, emotions, because generally when we talk about emotions, we associate it as something pathological, but emotions are part of us, are part of life. And we, as human beings, we are first and foremost emotional. We shape the expression of emotions to the extent that we have contact with the environment, to the extent that we have adequate psychological development and biological development. So, if we go to what it is, the origin of the human being and the development of what emotions are in children, we have to go to the first year of life. In that first year of life is when the expressions of emotions begin. Notice that generally we understand that children do not have the ability to express emotions until they are in the early childhood, as you say. But it's not that way. So the construction of that response to the stimulus of the environment is given by biology, by the brain structure, that when we have the education of this biological response is built with the environment, and with the association with other human beings with which we live. So emotions are social organizers. They allow us to organize socially. For what? Because if you smile at me, I smile you back at you. That is an expression of an emotion. If you do something that disgusts me, I get angry, and that's an expression of an emotion. Since when does the baby start expressing emotions? Quantifiable emotions that we realize is when the baby is losing that stimulus of the environment and is giving us an answer. We can say that it can be quantified in the first 2 months of life. Already begins what is a social smile. He starts chiku 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 chiku, and the baby smile because something pleases him. That is a social organizer. It is a social smile. Now there are children smaller than 2 months that are super irritable. They cry a lot. They do not calm down. They're angry, upset to the excess. And you may say, doctor, but all children cry. But there are some that children cry with desperation and are much more intense. That children is telling us that this child has some dysregulation in the emotional part. So tiny that's when the mother undresses herself, places the baby on her chest, sings a song, and calms him down. You have to make contact with the human being, the psychosocial part, helping it to regulate that answer to the stimulus, that reaction. So we move forward to the 8th month, and we see the separation anxiety, the desperate crying when they take you away from your caregiver. The children don't let go of tantrums when they're older. The tantrums start smaller because when they take you away from your caregiver, from the mother, you get distressed, you despair, and you cried a lot. Let's take an 8 months old baby. It's called the separation anxiety. That's the expression of separation as a social organizer. Then let's go a little further that it is the stage of what is the era of no, 2 years old. Already the child begins to say no for everything, and the child doesn't have any kind of problem. He's developing normally, properly, and is an adapted way. No, no, this no, that no. And with the emotions go a number of facial movements, body movements, even corporate movements, even sweating, tachycardia, and biological and physiological expressions of the body accompanied by stimulus.
Dr. Lacey, sorry to interrupt. A quick question. Now that you're mentioning that no, when a parent hears their toddler say no to everything, what should be the parent's response? Because we sometimes see that no as a child being rude, but it's actually an expression of the child's emotion, correct?
It is an expression of his emotions and a social organizer because the child is already telling you that he has a will. You don't want that because you first learned that he wanted that. Then what do we tell the parent? If that happens before the age of 5, it's part of a normal development. What's our role? To help him to channel that anger. We have to set rules and limits and teach him that life is flexible, that is not linear. So we sit down and explain to him at the child's level. Empathy, that is the importance of our role in the development of emotions, our parents. So we tell him, I, un- I understand that you don't want to drink milk now. Nothing happens. We're going to leave it there. You'll drink it later. Then set another goal. If you manage to drink the milk, you're going to have a privilege. Then he already knows that you're doing things instead of constantly repeating doesn't have a positive consequence. We are educating the emotion. And later we will see the need that we as parents of that baby that cries more than usual, that is a little older, we start we start to educate his emotions because if we don't, they will be generators of dysfunction. They will express themselves in an adequate way. So we begin to teach him that it is good for him to know that he doesn't want the milk now, but it is marvelous to know that when he drinks a milk for doing what he needed to do, he will have a compensation and incentive. We don't have to offer material things like taking here or there. Just verbal encouragement. Wow, champion, give me 5. Wow, you did it. You did it. Wow, you did it. So he can see the satisfaction. There's an expression of joy in the mother's emotion, the father, the babysitter, the grandmother, the caregiver, and they're happy, and he sees fear and he feels what it's like to be happy. So the child is going to substitute the no for doing things without using the word because it is gratifying to do what he needs to do, and from there he will have an adequate emotional development. Why is it necessary to see that emotional development at this stage within the context of the family life? Because later on we have the preschool age when the child goes to school. In preschool, when he goes to preschool, then the child must know how to control his emotions to be able to interact with his peers, to have a sense of belonging in a group because the other children are not adults to calm him down. They have their own emotional difficulties because they are living to face the world outside their home in a context that understands their disagreements and gives them regulation to turn that child into a being in a context that understand before 5 years of age. He's already in preschool and cannot break of anger, sadness, or joy, whatever he wants, but must have
Dr.
the
Lacey, so
ability.
sorry. We have seen, or rather, it's quite common to see in some schools that this is one of the major problems that teachers may have to face when young children throw a fit or throw a tantrum or have crying jags and fits of anger. So they cry and scream. And this typically happens on the very first day or the second day when they're left in preschool and they don't want their parents to leave them, so they throw a tantrum. So, around that age, should we expect a child to be able to control
Of
his or her emotions,
course,
or is that
it's
something
completely
that we
clear.
need to teach
Yes.
them to do?
Now, that example you mentioned is a normal for all kids to cry
No.
and scream when they are left in preschool. They are in the stage of what's called the first construction of emotional control. There's a part that's merely psychological that's given by the caregiver called bonding and attachment. That's how you bond to other human beings and how you attach to other human beings. You can be attached to the person that takes care of your caregiver without this being a problem or you being afraid of being away of the caregiver. If this process happened properly in the first year of life, that is a child that when he goes to school, you simply have to anticipate this. You have to tell him, this is going to your school, this is going to be your school. I will come back. You will stay here with your friends. I will go to work or will go home and I will come back for you. It's not going to happen. Nothing's going to happen. I will come back for you. And we're going to go home and you're going to tell me your experiences here. How do you do with the other kids? So you're encouraging him to socialize because we are social beings and to assure him that everything is going to be okay, that he doesn't have to be fearful of his emotions. He doesn't have to be angry. He doesn't have to be frustrated because mama or dad told him that in that place he was going to be okay. He was going to be secure and he's going to live new experiences. That's a child who's ready to go to that place. Then there's no reason why he will present separation anxiety at the beginning of the school stage because he was prepared for it in anticipation. We are talking about a child who has no regulatory control at the time of his emotions, but nothing happens because that's what we are here for. We have the opportunity to help the child until the beginning of the adult life to have self-control, to develop a concept that is very popular nowadays, that is emotional intelligence, and to have a proper, healthy, and happy expression of their emotions. Because healthy and happy, because emotions are not only joyful, sadness is also an emotion. And if you are sad because you probably have a reason to be sad. And if you are sad because you feel sad, you have to cry, get yourself a company to spend time with, leave and feel without being limited or reprimanded to continue the other process of life. That's why we go through the process of grieving. We go through it. We recuperate from that and we continue, but we leave it. Now, if the child keeps sad, isolated, discouraged, and this child that be it because of a specific reason or associated with a childhood psychopathology, or simply because he had an unsecure attachment with a caregiver, a link of insecurity might be that the mother or the caregiver was depressed or was sad or was not capable of giving him attention or singing songs or just let him run free even when he felt the parent of or caregiver was an aggressive person living in fear, anxious, those emotions were conveyed to the child that the way to be secure was to remain quiet, apprehensive, and fearful, because that way that was your mold to develop that emotional expression. So it is not normal that all children engage in terrible temper tantrums. To have to look at the individual, what happens with each of one of them, including if they were prepared or not for the beginning of that phase in their lives.
Dr. Leisy, as you just mentioned, emotional intelligence is a topic which is very interesting and which a lot of people are interested in learning more about. As parents, what can we do to help our children develop this characteristic we call emotional intelligence? Is it possible? But wait, don't answer me right now. Don't answer yet because we're going to take a little break and then we will return. Now, it's quite evident that God has blessed many experts with the skills and knowledge to help us in the rewarding but difficult task of parenting. Please stay tuned to see a video which presents a valuable book that I am sure will be very helpful to you, moms and dads watching us today. We'll be right back.
Parenting is a skill that can be improved and mastered with the appropriate assistance. I invite you to read Parenting, the Best That You Can Be, which will guide you step by step through the challenging responsibility of raising children today. Nancy Van Pelt, who was an expert in family life and the author of many bestsellers, presents this book, which in reality is a beam of light illuminating the path of all mothers and fathers who want the best for their children. Each chapter will take you on a journey to find the secrets to overcoming the most difficult aspects of parenting. As parents, what should you do when your children feel rejected at school, when they are unhappy about their physical appearance? What are the best steps to take? What if your family is currently going through a divorce? What if you are a single parent? What if you are considering getting married again? The advice found in Chapter 5 will prevent you from making mistakes that could leave indelible marks on your children's character. In the pages of this book, you will discover 6 effective strategies to build your child's self-esteem, and you will note an incredible difference in their lives. You will find this and so much more on the subject of raising children in the book Parenting, the Best That You Can Be. Would you like to be an excellent mother or father? Now is your chance. Obtain this book today at your nearest IADPA bookstore.
Parenting, the Best That You Can Be. So now you have lots of information about this book. Be sure to visit your nearest IADPA bookstore and you will certainly find this excellent book. We're back and with us is Dr. Leisy de la Rosa, who is sharing really valuable information about what we can do to help our children cope with their emotions. Well, Dr. Leisy, we have laid the foundation for the parents who are with us today. And now let's focus on that really important question. What can we do as parents to help our children to develop emotional intelligence when they have to deal or cope with all their emotions? How can we as parents intervene in this process?
Very well, Christelle. And it is good to clarify that we are talking about healthy children without any diagnosis of any intellectual disability or some cerebral paralysis, structural condition of the brain that prevents this process from occurring normally. Either we are talking in the context of what is the normal development of emotions and in the context of families that have children without any of those situations. By that, in the situation, a diagnosis that affects his expression of emotions, the approach is completely different. In the case of our regular families, we asked You asked me what to do, how to support them so that they can turn into emotional intelligence people who develop emotional intelligence. Let's be clear, emotional intelligence develops beginning with the family. That's a great responsibility. That's what is recommended first, to teach the child to speak. The first resource that a child should have is a word. That is a word. So as parents, we have to incentivize the child to speak about how he feels on a situation, to put a name to that emotion. I feel angry. I feel upset. I am sad. I am happy. And one of the most important things a child can learn is to put a name. That the father, mother, or caregiver put a name to their emotions. So what do we have to do? Start preaching with one of the most difficult things to us, the example. When I'm angry, I don't tell them, sit there. I don't feel like talking to you now. I tell him, look, mom is going through a bad time. Do this and we'll talk later. But I told him how I felt. Mom is sad. Then he asked, what is sad? Then I explained to him what to be sad means. So then when the small human being next to us is sad and he learns to put a name at what he feels, he will know why, because I'm teaching him to put names to his emotions. And there's no need to kick, throwing things around. We have to say how I feel, put a name to that emotion. That's the first indicator to have a good emotional intelligence, to be able to put names to the emotions. The second is to control. And how do we control that? To teach them. If my son kicks, I take a belt or an object and scream at him or correct him with anything, because I'm giving him resources to express his emotions in the same way. If I want him to be a human being capable of controlling his emotions, even when he's angry, that he won't turn aggressive, impulsive, even if I'm angry myself, I cannot behave impulsive nor aggressive. Generally speaking, in our culture, we understand that the more punishment there is, the better the child will turn out to be. Then we tend to express our emotions very intensely, but we want the child to express his emotions with little intensity and frequently. Then what we do, that sends mixed messages. A child without a clear message is not going to be an emotionally intelligent child, because you are telling him not to yell, don't break, don't beat, don't kick, but you're beating him up and you are yelling at him. You are hitting him and you are kicking him. And then he says, and because you can do it and I'm not. And then that's when the indiscipline begins in the home. That's the contrary what we want, that the indiscipline, and that leads the child to increasingly express his emotions with greater intensity and with less ability for regulation and self-control. And I mean expressions of negative emotions. In a family where 2 nights of parties are held and the neighbors can't sleep because we are the ones who celebrate the most, you teach the child that the day he feels happy, it does not matter who is around him. It doesn't matter who is around him or in what condition they are. What matters is only him, and that he has to express his happiness with the greatest expressions and as often as he wants to. Then that is an expression of positive emotion, but because it is unadaptable, increases the intensity and frequency, then they take the parents away from here. first we have to start having self-regulation. We have to be flexible, and that he understands. Flexible doesn't mean that we don't understand. It means that as human beings, we understand that he's flexible, and that he understands that even if he's angry, the world does not end. So we have to live in it in the eyes of the child. We have to say, hey, nothing happens here. You did not well in school. Today we're going to work twice as hard instead of telling you you did wrong. You did not do your duty. I'm angry at you. So every time that this human being has to deal, as adult, has to deal with the person under his responsibility at his job as a manager, and the person does not fulfill his responsibility, what he's going to do? He's going to mistreat him. He will be aggressive because that's the way he has to express his anger. It's the way he learned from his original family.
Dr. Leisy, what you're saying is really interesting, and I can't help but ask, because it's only in recent years that we talk about these things. We often hear our parents say things like, well, my father would say or do X, Y, and Z, but I didn't turn out so badly. I made it into adulthood. I'm well adapted.
And it's
What do you
very
think
good.
about that?
But let's see that they consider them. That's wonderful. I always say, and I tell parents, we give the best we are. We do the best we know. Unfortunately, every day there's a need for us to have a parental school, because back then we were raised in a regime that has been shown not to work out. It does not work because the society that we have today is not what many of us would like to have. Because if they are not the results we would like to have, the results were not ideal, because the education of our generation and the education of the generation after us was a very flattened education. With flattened emotions. Women had a role, fathers had another role, and children or child, the human being, another role. He couldn't talk. It was founded on power. That is, the lesser human being who had less power and the power of children. That is why I say the word then. They couldn't talk. They didn't have that opportunity. It was purely punitive education at one end, and at the other extreme, a very permissive, where everything was fine and things were allowed, or I was afraid because I was raised very rigid, and as I was raised very punitive, then I decided to do the opposite with my children. I will be completely permissive, and I will do what they did not do with me. And maybe that works because I do not consider myself an integral human being, emotionally sound and happy, and we see it's going to another area from the family structure. More than half of the families are single parenting families. They're divorced because they were probably not human beings with good emotional intelligence, in which they understood that you do not have to be right, nor should you be punished. The one who did not do the things I wanted them, but that simply have to self-control in order to live together in harmony with another human being who is different, in which you have to adapt to those differences. What happened today? Today the focus is positive parenting. Today you seek to talk to the child unless the child, from the time the children understand, unless the child has a cognitive discapacity that will prevent him from understand. And in that case, we also have resources, audiovisuals or behavioral resources, to let the child know that you understand. But the rules remain, because if you don't do it like that, the consequences will be these. So give an explanation, give an incentive. The This is what is called to develop an intelligence, emotional intelligence. There are parents that tell me, doctor, you mean I have to recognize my child? What does he supposed to do? Do I have to reward him because he obeys me? No. You feel proud of him. You feel proud of him that he was able to achieve something to control his emotion, and you feel happy. You are showing him that happiness is good, and you are happy because he did something that was hard for him to do before, and then encourage the positive in the same way that I encourage those accomplishments. I also encourage the positive. And as I encourage the positive in his development, I'm taking away the expression of the emotions is a behavior. Then I smile when you smile. Emotionally, I feel content because I'm receiving a smile from another person, which is a symbol that I'm a likable person. But the behavior is a smile. Now, if you smile at me and I don't smile back, something is wrong, because it's not only the excessive expression of the emotions, but also the expression of the emotions. They are children that are sad. They can't say it because in their family, people don't talk about their feelings. They are children who are cheerful until they get to their doorsteps, because in their family, people don't show that emotion. They are living it. People live affectionately flattened. So what is he going to do? Human beings who are going to have to adapt to dance that dance in order to survive in the system where he spends most of their time. Every day, we have to spend 5 minutes to talk about how children feel emotionally. What expressions, what situation were they presented with, and how they responded to those situations emotionally. And we help them. We tell them by example. You know that when I was a child, this happened to me. And this is what it worked for me. Try it to see if it works for you, if it makes you feel better. Then the child who was very anxious about school, doing temper tantrums and crying a lot, you can tell him, this happened to me and other children that I knew when I was a child. So these are some of the strategies that you have to develop. It all depends on the culture. There are cultures more expressive than others. But all civilizations, Eastern and Western civilizations, are merely emotional and sociable, even if the expressions are different by cultures.
That's right. And that's why we're having this conversation, so that as parents, we can build, as you mentioned, a better generation, we can build a better society, and so that our children can grow in a better society and environment. Dr. Leisy, to conclude our exchange, I would like to ask you, are there new trends or new techniques when it comes to children coping with their emotions that you have practiced or that you're learning about that you can recommend? And could you put them in simple terms so that we can not only understand but also remember and put them into practice?
Before I talk about trends, I'm going to give them a few brushstrokes of 30 seconds. I'm going to identify when we are dealing with an emotional dysregulation disorder, because we have talked about a lot about incentivize them. The fathers, the parents listening to me. When I say fathers, they ask me, and what about the moms? And they ask me, and the moms and the dads. For example, parents in general sense. I always say that men are the most emotionally sacrificed because culturally speaking, they were taught that men don't cry, that men don't bend, that men don't get sad. So men have a hard time expressing emotions in the whole sense of the word. then we realize that we are facing an emotional dysregulation of our children, First of all, because after the stage in which we have already clarified above are developed tantrums, oppositionist and challenging negative behaviors, the child begins to behave the opposite way, to hold grudges. In other words, he has a negative experience at home or with someone. He says, I always remember what you did to me, or I always remember that moment, or I don't love that person for this or that. That's a child that is keeping that emotional experience in a very inadequate way. And in due time, that emotional experience can generate a psychopathology development, including childhood. When we see children that change emotions very abruptly, a child who might be very sad, distressed, isolated, and suddenly he becomes super happy, even inappropriately approaching people who are not so close to him, that's an indicator that that child has likely an emotional deregulation that we have to work on to identify what's happening. We have to seek professional help. The expression of his anger, and anger is so great that it becomes destructive, aggressive to peers, do not respect the figures of authority, neither the rules. They challenge the parents and the authorities in the house. We are facing an emotional dysregulation and probably a behavioral disorder. Then in these cases, I say you have to go to a professional psychologist to identify if we are facing a pathology of Aston. In other words, in the face of a condition, be it childhood depression, the face of a condition, a childhood anxiety disorder, bipolar illness, or we are simply facing a child who is being the victim of bullying, and how the child feels sad and frustrated by what he's experiencing in the school environment, walks with an emotional dysregulation, or the child who has poor school performance or has some learning disorder, or attention deficit disorder or hyperactivity, and does not meet the age requirements for the school system. Then the child lives angry and frustrated and begins to express the emotions of anger, aggressiveness, with impulsivity, with greater intensity and frequency. Then, so it's normal that for children to get angry. Now, it's not normal for children to assault. It's not normal for them to destroy, to harm them, to harm each other. It's not normal for them to lie, to manipulate. It's not normal for them to destroy and not to respect authority. Then when all of these things happen, that the child is not part of the normal development of the normal human being in the childhood, we are faced with the presence of emotional dysregulation that could be associated with a pathology of Aspen or some family situation. It is happening in the environment of the child himself. His idiosyncrasy, the individuality of that child, and in the development of his brain functions, that this authorization does not accurately regulate his emotions, or that there are some expressions of irregular emotions that might be symptoms of some pathology of childhood. Pathology, then, already going to what you mentioned, and there's tendency to address what the approach of emotions in children should be. The tendency today is to educate us on the positive parenthood. For us to work in the exercise of positive parenthood, it doesn't mean that we don't have to work and that we have to stay with the child all day, and that most of the situations that happens that occur in children happen because the mother is going to work or the dad goes to work. It's not that. We have to give him quality time in which, regardless of our functions, and the multiple things that we have to do, we choose to be parents. So being parents cannot be by chance. No family should be formed by chance. Being a parent should be a mature decision in which you, as human being, already an adult, are willing to sacrifice your identity of that human being to build the identity of that human being that you decided to bring to the world. That same privilege is a privilege that God gives us with fatherhood and motherhood. That privilege has also a job that must be done in order to enjoy it. So in that work, the tendency is to educate young couples from courtship, from the pregnancy, so that the couple understand that it is their pure and important responsibility, the emotional health of another human being. So in that process of education comes that what is the emotional guidance of parents, positive parenthood. There are many authors inside and outside the church who talk about prevention, because the trend in the world is to prevent emotional dysregulation from emotional prevention. We go to what are the schools of parents, the exercise of a positive parenthood, where we show what it is, the emotions of parents, so that they can live in the environment and can intervene in their children's behavior. You asked me off camera, doctor, if there is a tantrum, is it worth it to intervene at that right moment? Do you have to wait until the next day to sit him down and explain what happened yesterday? At the moment. And that's a tendency to prevent. At the moment. The child is angry, making a tantrum, and you are next to him to control it. Because remember that you are the role model to follow.
So I can't do just like the child. I can't get upset, right?
Controlled. You have to tell him, listen, you don't have to cry, you don't have to scream, you don't have to kick. We can talk about what's happening. No, I don't want to talk to you. He pulls away, he throws things. The child doesn't want to talk to you at that time. You supervise that the child is not in a place where he can hurt himself or others, because some parents, when you say it's time out, they see that as an opportunity to leave the child. Then they pick him up, the child, and is hurt. No, you supervise from where you are. You make a second call. You say, stop, listen. Remember, we are talking about a child that sees, hears, and talks, because if you say it to a child with autism disorder, this probably doesn't work. And if he needs a specific modification, stop. You already told him stop. You can use whatever word from your culture. Stop. Enough. Stop. Listen. You have 5 minutes to calm down. If you do not calm down in 5 minutes, you will lose a privilege. You announce it to him. Because generally, we take away the privilege first. As you behave wrong, you will not watch TV. But you did not tell him that his behavior will have a consequence. That's not fair. Because if he didn't know that he had an alert, a consequence, you already told him in 5 minutes. And in 5 minutes, you don't get yourself together, you will lose that privilege. So you already told him, wait 5 minutes, so he will get himself together. And if in 5 minutes he didn't, you lose the privilege. If you say something, you do that even if your heart hurts. Now, the consequences should be proportionate to what happened. You cannot give him a whole week without TV because he will get used to not to watch TV. You can take away an hour, 2 hours, not the whole week. The child kept throwing tantrum, nothing happens. This is the place where you're going to do your tantrum. You put him on a corner where he's not going to be hurt. The parent sits at a distance where he sees that he's not going to hurt himself and waits until he's done. Are you ready to listen to me now? Immediately given the behavior, then there's a corrective. The feedback, the behavior and misfit. Expressions of the correction are done in the moment it happens.
So right when it happens. It's interesting what you're saying because nowadays we find so much information, so much advice, and so many tips, especially on the internet, that may seem to be confusing and contradictory.
Christelle,
So it's
that
always good to talk to an
internet
expert
is
in the matter.
something wonderful. Because that's why you and I are talking from a fairly prudent distance. But what happens with the internet? The internet turns freedom into debauchery. And at the end, everyone writes what they please and what they believe in their heart without having the minimum preparation to do it. And people talk about their experiences many times, understanding that what they do is good, and simply what they are looking for is acceptance and approval. So many times in the midst of diversity, also, if we wouldn't exist as parents, children would be produced as chickens in an incubator and not in a family. We exist as parents to be able to discriminate everything that bombards our world from the point of view of billions of citizens that are out there, and to be able to do what is determined and scientifically proven, what works. And then when we talk about what's determined and scientifically proven to work, then we experience our values based on our culture of our individuality. That's what it works. Determined if I'm going to apply it or not.
Very good, Dr. Leisy. Thank you so much for being with us today. Thank you for giving us of your time. I really wish that we had much more time to ask you so many other questions. I know that our moms and our dads have tons of questions that they would like to ask, but I want to say to those who are with us today, if your child is demonstrating any of the negative attitudes that we talked about today, or if you have any concerns, please be sure to take them to a professional just as Dr. Leisy has recommended. This expert will be able to determine if your child's behavior is normal or if they will need any help or treatment. There isn't a lack of Christian professionals out there who can help us. May God bless us and help us to have happy children in our homes. Thank you once again, Dr. Leisy, for your time and for sharing your knowledge and experience with us today.
Thank you, Christelle, and everyone for listening.
Very well, my friends. Thank you so much for tuning in today and for staying until the very end of our program. If you participated in our live chat on Tuesday, you know that today we will have the opportunity to win one of 4 free books. So at the end of the program, we will upload a post with the names of our 4 lucky winners. So please check out our post to see if your name appears. Thank you once again for joining us today. Please stay tuned for some important information that you need to hear. Be blessed and enjoy the rest of your day.
IADPA, donde cada libro es un mundo nuevo.
We want to thank Dr. Muñoz for sharing this invaluable and useful information with us. We also want to thank Dinora Rivera the Director of Children's and Adolescent Ministry of the Inter-American Division, for collaborating so closely and so actively with us in planning and developing this program. Without her contribution, this event would not have been possible. Finally, we want to thank all of you who from your homes, churches, schools, and countries overseas have accompanied us to participate in this informative seminar, which is the first of a series of 3. We invite you to join us for our next event, which will take place on May 1st at 4 p.m. Eastern Standard Time in Miami for Dr. Carlos Fayard's seminar. Dr. Fayard is a professor of psychiatry and the director of the World Health Organization Collaborating Center at Loma Linda University School of Medicine. He is also the Associate Director of the Department of Mental Health Ministry for the General Conference of Seventh-day Adventists. His seminar will address the interesting topic of the impact that reading has on children, especially when comparing reading printed books versus reading on digital devices. We hope to see you again next month on May 1st. But in the meantime, let us follow Ellen White's advice, which is found in The Desire of Ages, chapter 56, page 516. By gentle touches, by loving ministrations, seek to fashion their characters after the pattern of the character of Christ. Consequently, just like Jesus, our children will grow in wisdom and in stature and in favor with God and all people.
Yeah.